وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا في بث حي ومباشر عبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning, Michigan. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues.
Good morning, and thank you for being with us. This is Khalil Hachem at the Local Connections. Khalil Hachem. I'm the editor of the Michigan.com. This segment is brought to you in cooperation between the Michigan.com and US Arab Radio. US Arab Radio is the best ethnic radio in North America. Good morning again, and to you this Friday. Today is Friday, March 18, 2022. It's a colder day today than yesterday. And we may get some rain later on, but we're not complaining. It's going to be in the 50s or 60s maybe. Hope you are having a nice day today. The number here is 248-557-3300. Give us a call should you have a question or a comment in Arabic or in English. There's a lot in the news today. We're going to be talking later on with a representative from the state to tell us a little bit more about a program for small business, where small business owners can apply for a grant to help them through the recovery of from the pandemic. The pandemic was very hard on businesses, and a little help from the state. I think the state got some $50 or $500 million or $50 million from the federal government to help small businesses. We'll be talking to Stacy Lisner later on in the program. Also, we'll be talking to Dr. Avani Sheth from the Wayne County Health Department. There's a lot of news about the coronavirus. In our minds, the coronavirus is done with the pandemic, but it's really not. And then we need to learn more about what the new regulations are and what we need to do and how we need to do it and what's going on with the new variants. What do we know about it? Do we need to get vaccinated? All of this info we'll be talking to Dr. Sheth later on in the show. Of course, the war the dominant news are the war in Ukraine, this unfortunate war. It's so heartbreaking to see all of these refugees, to see all of these cities being destroyed, and war is ugly. I don't care what whose side you're on, but war is ugly, and war changes lives, changes countries, changes everything, forever. And look what happened to Syria. Syria, one of the most beautiful country and great people and culture, and Damascus, the most continuous city in the world, and look what happened to it. And it's really heartbreaking to see the plight of the Syrian people all over the world. In some part of the world where Syrians are living, it changed their culture, changed everything, changed their family, changed a lot of things, and changed the country. The country will, if it goes back, it's going to take years and years and years and years and years. Same thing in Ukraine. Sometimes one thing that I think we are caught up in the rush because we want to support Ukraine against Russia, take sides in this, in this conflict, and I understand. But at the same time, we forget the responsibilities. I think that definitely, what the Russians are doing is wrong, and they should stop that invasion. They should stop the killing, and they should stop that war, and it's totally unnecessary. At the same time, I felt that the Ukrainian president, he should have done more to avoid his country from being destroyed. Even if Russia fails with the invasion, at the end of the day, Ukraine will no longer be the same. Yes, you can rebuild the buildings and you can rebuild the streets and the factories, but you could never rebuild the human beings, those who have been lost, those who have been displaced, and those who have been scarred by the war. That's going to be really tough to repair. Unfortunately, it's a tragedy. And I hope that American media will continue to do the same when another war breaks out somewhere, and then we're trying to cover it up. Recently, Saudi Arabia executed 81 people, most of them just because they're a certain minority. And, we know how Saudi Arabia and their record of human rights, horrible record on human rights, and there was nothing in the media about that. So that selective in American media, that selective topics to cover is very disturbing. So far they've done a really good job. Sometimes they get overboard with the coverage in Ukraine, leveling a lot of charges against this group and that group, and I don't think that the media should get involved in that. They should just tell the truth, tell what's going on, and they shouldn't really become an extension of the American propaganda, American government propaganda. So that, unfortunately, the in recent years, like 10 to 15 years, since the second Gulf War rather, the Iraqi war, American media has become mixing opinion and news a lot, and that shouldn't be. There should be totally separate. Opinion is opinion, and news should be news. No doubt about that. So unfortunately, that now the war in Ukraine is affecting us. It's affecting our pockets, as you well know, and it's affecting us at the pump. One thing I was very disturbed, is the fact that even before we stop getting oil from Russia, which we get very little, it does not really impact us. The media start making excuses to why the price of oil is going up. And then what was really disturbing is that everybody thought that, by paying more at the pump, we're helping Ukraine. How are we helping Ukraine? We're not helping Ukraine. We're putting more money into the pockets of the oil companies and making them fatter and fatter. We're not helping Ukraine. In fact, we're helping Russia, because if the price of oil goes up, Russia continues to sell oil. Russia is making more money. So we're not really helping Ukraine. We're helping Russia and making the oil companies, making them fatter and richer. So just by paying at the pump or not. Other stuff are expensive. I did look up today some info to share with you. How can we save at the in this time of high inflation and everything is getting, because once the oil market goes up or the oil prices go up, that affects everything. So and if you go to the grocery store, we can see that, we can feel that bite into our wallet. So here's some recommendations that I looked up and I want to share with you. I already use some of those because they do save money. And if you save $5 here, $10 here, before you know it, you're saving some substantial amount of money at the end of the month. Number one, it says pay with grocery reward cards. Some grocery stores, if you go to the major ones, like the Kroger's and Targets and so on, so whatever it is, they have a reward card. That reward card really saves your money. I always save $5, $10 on shopping by using the reward card, because these stores are trying to push certain products and they give you discounts on that. Sign up for loyalty programs. Again, loyalty programs, you can save money on that. I do my shopping at Kroger's, and then I use the same card for gas, and I always save 10-15 cents on gasoline per gallon. 10 cents per gallon is a lot of money. Clip coupons. These stores will send you. They're a lot smarter now. They identify the things that you buy, and then they send you coupons. Again, that's $5, $10 right there. Join a wholesale club. I go to Costco. Some people go to Sam's Club. You can save money if you go to buy in bulk, and then if you have a plan and know what to do. Go in with a list. Make a list before you go. Don't go like haphazardly and just browse the aisles and try to get things that, excuse me, that you really don't need, and buy what you need. Buy items on sale, identify sales, and avoid prepackaged or processed items. They're going to cost you more. So buy the stuff that you can work with it at home. First, it's better. You don't have to worry about processed food, and it's cheaper for you. Compare prices between stores. Some stores, there are a lot of apps today that will help you compare prices. Use those. Buy generic brand. This is so true. For example, at Walmart, at Target, last time I went to buy some ibuprofen, the difference in price is more than half. It's more than half. It's the same medication, ibuprofen, same thing. It's a Walmart brand or Target brand or any other brand. It's the same thing. You're paying half of the money. Bring your own bags. I don't know how this is going to save you money. I guess in some stores they do charge you for bags. And use a rebate app. Some apps provide rebates, and you can get some money back. Excuse me. Using all of these different techniques will save you a lot of money. And then focus on the major stuff. So when you go to the store, focus on what you really want to get. We're going to be talking more about this later on. Please stay tuned. We're going to take a short break. Stay tuned.
Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Dana, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600. Enjoy the first Syrian-style cuisine in Michigan. At Damas Cuisine and Catering, you'll find a wide selection of Syrian foods and sweets in our menu, like frikeh, hoisin, grape leaves with steak, mashawi platter, hot mahashi, char-grilled kebab, shawarma, and much more. Get super fast delivery from Damas Cuisine and Catering right to your door. Order online at damascuisine.com/menu and track your order live. Damas Cuisine and Catering, 28841 Orchard Lake Road in Farmington Hills. Call 248-987-4985.
Are your hands feeling numb? Do you feel pain opening up a jar, turning a key? Are you noticing that your elbow and your shoulder are becoming stiff? Or were you recently injured in your arm? Hello, I'm Dr. Albanjit Katranji, and at the Katranji Hand Center, which just recently opened down the street from the Somerset Mall, we can provide you with the latest in hand, wrist, elbow, and shoulder care. Visit us at www.katranjihandcenter.com to learn the latest techniques that we have to offer you, and I look forward to taking care of you.
Visit us in Troy at 1565 West Big Beaver Road, Building F, or call Katranji Hand Center for an appointment at 248-869-4263. That's 248-869-4263.
Welcome back, and thank you for being with us. This is Khalil Hachem with the Local Connections. We've been talking about how to save money and how to do better during these tough times. Whether it is the war in Ukraine that is squeezing our pocket, or the pandemic. And the pandemic has been really, really tough on small business. Small business have been suffering, and luckily that the state and the federal government have been trying to help. And recently the state has a new grant program to help small businesses. With us this morning, Stacy Blizner, I hope that I pronounced your name correctly. She's Assistant Deputy Treasurer, Financial and Administrative Services with the State of Michigan, the Michigan Department of Treasury. Good morning, Stacy, and please correct me if I mispronounced your name.
That is okay. It is Stacy Blizner, but that's okay. And thank you for the interview.
Welcome. Absolutely. Thank you so much for being with us. Please tell us, what is this program and who are the beneficiary and how they can get some help?
Absolutely. So, okay, I want to inform your viewers about a great new grant program that will provide businesses with additional financial support to the tune of $409 million to help retain and create jobs and boost our state's economy. The grant program is called the Growing My Business Grant Program, and it will help support businesses that were impacted during the COVID-19 financial pandemic. Okay. It works by providing financial hardship assistance to these businesses, like I mentioned. For example, eligible businesses that met a sales reduction from 2019 to 2020 that were also in operations before October 1st, 2019 may receive a grant up to $5 million. The financial hardship will be calculated based on specific expenses that they incurred in 2020. Also, eligible businesses that began operating between October 1st, 2019 and prior to June 1st, 2020 may receive a grant equal to 25% of their certain specified cost. Grants also may be prorated to ensure that all eligible businesses do receive something.
Absolutely. So how do you determine who's eligible?
Yeah. All right. Well, under state law, businesses must not be tax exempt. They also must not be government entities, and they must fall within one of nine categories according to the statute. Those categories are entertainment venues, recreational facilities and places of public amusement, barbershops and cosmetologists, exercise facilities, food service establishments, nursery dealers and growers, athletic trainers, body art facilities, and hotel bed and breakfasts. And again, they must meet the sales reduction requirements per the statute.
Now, does it have to be, do I have to be a big business, or can it be like just one owner kind of business?
It does not have to be a big business. It could be a small business. You could be a sole proprietor. You could be just a cosmetologist, or you could, it ranges. You could be a cosmetologist all the way up to franchise restaurant owners.
And these are grants, which means they don't have to pay them back.
That is correct. This is not a loan. It's not a business loan. These are grants that are funded with ARPA dollars that are intended to compensate for the past financial harm experienced because of the COVID-19 pandemic.
Okay. Do consultant LLCs are eligible for that?
Consultant LLCs are not eligible. The consultants are not one of the 9 business categories that are mentioned in the statute.
Okay. And media businesses, are they also involved in this?
That is a good question. I'll have to go research the statute on that. I know that we have a lot of information on our website as well that people can look into and just see if they actually apply. The website is michigan.gov/ABR. Again, that's michigan.gov/ABR. And the website has a lot of information, including frequently asked questions, a program checklist, so that also will help you get prepared prior to submitting your application.
Okay. What's the time for people to apply?
All right. So the timing for businesses to apply, the application process started on March 1st, and they must submit the application by 11:59 p.m. on March 31st.
31st. And, of course, they're going to have to provide you with tax information and so forth and so on.
That is correct. There's several pieces of financial information that we are going to ask for so that we can validate the sales tax reduction, along with supporting documentation showing those numbers, reduction in sales. We're also going to ask for certain business expenses so we can calculate the financial hardship. And all that information is also within the checklist. And the application's easy to walk through, and you can see all the categories.
Sure. Is this money taxable?
Yes, this money is taxable by the IRS. One of the documents that we are going to require with the application is the IRS W-9 form so that we can collect the taxpayer identification number.
Absolutely. And, in general, it doesn't hurt anything People apply. If they're not qualified, the worst I can tell them is no.
Absolutely.
Yeah, they're not going to lose anything.
You're not going to lose anything. So
No,
please go out, check out our website, look at all the information, and if you feel you're eligible, please apply. Again, the website is michigan.gov/ABR, michigan.gov/ABR. We also do have a call center. If you have questions and you want to call and ask about the business grant, the phone number is 1-866-507-8462. And we also have an email box.
Could you repeat the phone number, please? 1-866?
Yep, 1-866-507-8462. And our email, in case you want to email us questions, is TREAS, which is TREAS-ABR@michigan.gov.
This is a great program, and small businesses really need that help. And again, how long does it take for the money to come?
That is a great question. So by statute, we need to have the payments out by July 1st. So after March 31st, the deadline for the applications, we're going to be reviewing the applications for the next couple months. We are going to send out awardee notification letters in early summer. And then again, the payments will be distributed by July 1st. Absolutely.
Does it come in at a lump sum or does it come in payments?
It's going to come in a lump sum, and it'll be an electronic payment into their bank account.
Wonderful, wonderful. Is there anything I haven't asked you that small businesses need to know?
I would say that some of the things that we're experiencing with the applications is that not all businesses are putting all of the expenses that they need to in their application, which is what the financial hardship is based off of. So when they go to apply, make sure that they fill out those specific categories and enter their expense amounts. We are noticing that they're uploading documentation to support the expenses, but they actually entered zero within those expense lines. So it's very important that they enter the expense amounts that they incurred so that we can calculate their financial hardship.
Absolutely, absolutely. This is really a great point because, the more the information is correct and, the faster the process would go and be accepted and
absolutely.
Eliminates the back and forth and doing all of these things and possibly being rejected, because if they don't provide the right information, we encourage you to, as a small business, to, seek some help if you need it. And before you hit that submit button, make sure everything is done correctly. So I'm going to ask you to repeat the website one more time. And I thank you so much for doing this.
Absolutely. Again, the website is michigan.gov/ABR. That's michigan.gov/ABR.
Okay. In total, some, I think I mentioned that at the beginning of the program, is it like 500 million, the state did?
I apologize. It's 409 million, up to 409 million.
Yeah,
so it's a lot of money.
It is. And I hope that small businesses would what's the definition of a small business?
And I'll be honest with you, I wouldn't know. It's not necessarily a small business grant program.
Okay. It's just for all businesses.
It's for any business that that qualifies under those 9 categories. Okay. Can apply. So
sounds good. Yeah. But I hope that more and more those really, really suffering small businesses would apply and benefit from this program. Stacey, I want to thank you so much for being with us. This is valuable information, and I hope that more people will benefit from it.
And thank you for having me.
Absolutely. We're going to take a short break. Please stay tuned.
Are you going to start a restaurant or a grocery store soon? Do you need floor plans and designs? Call Naji Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Naji Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Naji Abood, 734-744-9796.
Get ready for an amazing experience at Ishtar Restaurant on 15 Mile Road in Sterling Heights. Enjoy excellent hospitality from owners Ali Al-Baghdadi and Fatty Bonham, serving the best in Mediterranean food. Try Chef Ali Al-Baghdadi's famous shawarma, the best Iraqi grills and food, and the best Arabic and international dishes. Dine in our authentic atmosphere or take out. Call 586-698-2585 or check us out on Facebook. Ishtar Restaurant practices all CDC guidelines and is open every day 11 a.m. to 10 p.m. Have an amazing experience today at Ishtar Restaurant, 3625 15 Mile Road, Sterling Heights. Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493. At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Welcome back, and thank you for being with us. This is Khalil Hachem with the Local Connections. I hope that more and more of small businesses will take advantage of this program. $490 million to help small business is a lot of money. So, and normally big businesses try to grab it. So I urge you as a small business, please, go ahead and apply. And it's first come, first serve. Before that money goes out, it's a great help. If you suffered losses, this is really a good way to get some money back. We're going to be, hopefully, we're waiting to be joined by Dr. Avani to talk to us a little bit about the coronavirus and give us an update. This is on everybody's mind, and at least on my mind. I noticed that more and more people are not wearing masks, and more people think that the pandemic is done with. It's not, and we need to be a little bit vigilant. And I understand we're tired. Yes, I'm tired. I'm really sick and tired of the mask and all of these corona related measures that we have to take. And I'm really tired of not being able to visit our friends and our friends coming to visit us, and it's unfortunate. I hope that life will change soon and go back to normal, and there's nothing better than that friendship. That these relationships. It really shows. Studies have shown that having that social network, how healthy it is in trying to, for us, whether it is psychological or physical, it's very healthy, and it's good to spend time with family and friends and have that social connection, and it's good for the kids. I think children are suffering the most, and I hope that things change so they can get back to normal. And I can see it, with my children. They Yusuf is 16 and Layla is 11. And sometimes, they say, Dad, we want to go here, we want to do this, we want to do that. And we say, well, we're not really sure. I want to go see my friends. I want my friends to come and see us. Again, we're not really sure how this is going to work, and we have to be careful. So I hope that we don't have to say that anymore this year, specifically this summer. Ramadan should be coming up very soon. That's a great time for us to for us to for those who observe Ramadan, it's a good time to take care of our bodies, take care of our connections with ourselves. Things are what you do with it. We fast, and for those who are not familiar with Ramadan, that's the time when Muslims fast, abstain from eating, drinking water, that is, and things, juices and all of that, from dawn till sunset or after sunset. So and it's that time when the fasting takes place, and you can see it in the whole community. So the whole idea of Ramadan is that we learn from it. The whole idea of Ramadan is that we remember the poor and we take care of the poor, and I hope that we observe it peacefully and safely this year, and then we learn from it, and then we slow down a little bit. One thing about the coronavirus that taught us is that during that time, what happened is that, I don't know if you remember when it first hit, I think sometimes in February or in March, and then we were kind of isolated for 2 weeks, 3 weeks. We just didn't go anywhere. We stayed home worldwide. And it was incredible how it benefited everything. And how, it benefited us, it benefited our bodies, it benefited our souls, it benefited the environment was better, we can see the stars more. So it's really, really important to do that. And we're going to be talking about this later on, but now we're going to continue to talk about, or we're going to return to talk about the coronavirus itself and then the vaccine. And with us is Dr. Sheth. I think I'm hoping that I'm pronouncing your name correctly. Good morning, Doctor.
Good morning. Yeah, that's correct.
Okay, Dr. Avani Sheth. She's the director of the Public Health Division at Wayne County Department of Health, Human and Veteran Services. And thank you so much for being with us. We really appreciate it. And congratulations on the new post. I think you've been there. You're the new director there. Is that correct?
Yeah, that's correct. That's correct. Thank you for having me.
How long have you been there? A couple months?
Well, I think it's almost a month. Time has been flying by very fast.
Wonderful, wonderful. Thank you so much for being with us. So, what's the update on coronavirus in Wayne County? And I see people don't want to wear the mask anymore. And is that a good thing, or should we be vigilant? And also, we want to talk about, the pandemic is not over. We still need to take the vaccine. So, what do you think?
Yes. So in Wayne County, we are seeing all the important measures of how well we're controlling the spread of COVID-19. And so this is case rates, hospitalizations, percent of tests coming back positive. All of that has declined pretty significantly since the surge that we saw with the Omicron wave. And really importantly, hospital capacity has also stabilized. So they're operating much more safely right now. And so we're at the point where we're at levels we haven't really seen since probably August or September. And so this is a bit of a different point in the pandemic. And as you mentioned, we have readily available, safe, very effective vaccines for all those 5 and up that we didn't have last year. And so that being our single most effective tool to prevent against severe illness and death. And so we've kind of shifted at the moment to this new phase of the pandemic and our response, right? We're coming off this surge. And for the moment, we are in this recovery phase where, as you mentioned, COVID-19 is not over, right? It continues to circulate in our community, but we have much more control. And we also have many of the tools to keep us safe and protected. In this phase, it's going to be, very important for the public health department and all of us to continue to monitor conditions, new variants, and adjust our recommendations accordingly. But it is a moment where we have, a little bit more control. It's a manageable risk at this point, and we have to kind of be prepared for whatever comes next.
I noticed that not many people are testing. Is that a good thing?
Mm-hmm. Well, the demand for tests have come down, And that is probably much linked to the fact that cases are coming down, right? But again, and many people are hopefully using their home tests that many people have been able to access, right? And so we're not seeing as many people coming to testing sites. That is probably a reflection of cases coming down. However, it's very important if you have any symptoms to still get tested, right? Because that will be the information you need to know if you need to stay home, stay away from others. The main thing is that if you do get COVID-19, you want to keep it to yourself, right? You don't want to spread it to others or somebody at risk in your household. So it is still important to get tests. We have several testing sites across Wayne County for folks.
Now the numbers at the hospitals, how much have they gone down?
So our hospitalization rates for COVID-19 have declined significantly, like 90% since the peak of, probably more than 90% since the peak of the Omicron surge. So, and the hospital capacity in terms of, percent of hospital beds with patients with COVID-19, that has declined significantly. So hospitals are still very busy places, but we're not seeing the stretch in the system that we did with the Omicron surge.
Yeah. Now, is this really hospitalization is the key indicator that we look at when it comes to measuring how strong the pandemic is?
Yeah, that's a good question. So we look at several things, right? Hospitalizations are important because it's our measure of how, severe the virus is impacting the population, right? How many patients are actually having to go in and get hospitalized for treatment. But case rates are important as well. We look at cases in the community and case rates per 100,000. We look at percent of tests coming back positive. That is also a measure. But COVID hospitalizations, percent of beds occupied by patients with COVID-19, we are looking at that more closely now because we have these safe and effective vaccines. We have a population that is either vaccinated or has been exposed to COVID-19 at some point, so has some level of immunity. And we want to see that, though we have people, are still getting infected with COVID-19, it's very much in the community. We are really concerned about folks going to the hospital, right? How are they at home with a bad cold, or are they in the hospital, right? And that's what we really want to prevent.
Absolutely. And just like to remind everyone, there's, new medication out there. There's a lot of help, and it's important that, people get tested because this is how we can track it. And now the vaccine, just because the pandemic, the numbers are going down, it does not mean that we don't need to be vaccinated. And, that, correct me if I'm wrong.
No, you're absolutely correct. And if I could leave your listeners with one message, this is the time if you haven't gotten boosted, this is the time. And so in this phase that we're in, we really need to focus on what we know works, right? What is our tools that work? And these vaccines are incredibly effective. And they're their single best way to protect from severe illness. Like I said, right, you can have COVID-19, you can get a bad cold and be, home for a few days, or you may need to go to the hospital, right? And that's what these vaccines really do. They prevent against that hospitalization, they prevent against death. But they also, and I want to lift up this point that many people don't realize, that they're shown to be protective to reduce the folks that sometimes get long-term symptoms with COVID-19. So these are people who may have had mild COVID-19. They didn't have to go to the hospital, but they're still suffering, weeks after being sick. And so they're shown to reduce the risk of those long-term symptoms too. And so right now, all children 5 and up should get vaccinated. All 12 and up should get vaccinated and boosted. We know that in this last Omicron surge, that booster was really important in keeping people out of the hospital.
Absolutely. And you mentioned something very important. I want to repeat it so our listeners can understand it. The intention of the vaccine is that you won't end up at the hospital. You know, a lot of people think that the vaccine is going to prevent you from catching COVID. It does not.
Right.
You know, but it just protects you from going to the hospital. And how do does the vaccine also helps with the transmission? If we're vaccinated, we won't transmit the virus?
Yes, and we saw this before the Omicron. They were very effective in preventing against transmission as well. But with this new Omicron variant, it was more immune evasive, meaning that because of the mutations in that variant, it kind of slipped through that immune response from that vaccine that we got. So it was, so we saw many more people who were vaccinated become infected with COVID-19 with the Omicron variant. And so that was, the big difference from, 6 months ago when people were, getting sick. It was mainly the people who were not vaccinated, right, at that point. But at the same time, the vaccines were still held up against Omicron to be very protective in preventing hospitalizations and deaths.
Absolutely, absolutely. Now, the fourth shot, they're talking about a fourth shot. Is that, they already asked the FDA if once they approve it, is that something like within a month or two could be or something like that?
So so we don't know, if FDA has to review the data. Pfizer and Moderna, as you mentioned, submitted for approval for a fourth booster dose. So we will see the outcome of that. And just to, the background with that is that in the Omicron wave that we just have come down from, the booster was very effective, about 90% effective against hospitalizations, but we did see that decrease, though still high, around 78%, if you were around 4 months after that booster shot, that if you did receive a booster. So the immunity does wane over time, and that is not unexpected. And so what the scientists and the governing organizations around vaccines and vaccines approval, which is pretty rigorous in this country, they're really looking at the data and saying, okay, what is the impact of that fourth booster? Does it really increase protection, and for who? And I think that's going to be very important. As you saw, I believe Pfizer submitted for approval for those that are 65 and older. Those are the ones that are most at risk for severe illness with COVID-19. Moderna submitted for, all adults. So we will see what the outcome of that is. But a fourth booster is very much likely in our future at some point, if not for a portion, if not for all of us, at least for a portion of the higher risk population.
Exactly. What do we know about the new variants that's really making news in China?
Yeah, so this BA2 variant is increasingly becoming increasingly circulating in our community, in the U.S. as well, and CDC is tracking that, and it's basically, from coast to coast in Michigan as well. We're following it very closely. What it seems like it is more transmissible, so it spreads more easily than the Omicron variant, which was also very transmissible. But we don't know yet what impact that's going to make, right? There isn't necessarily evidence at this point that it causes more severe disease than we saw before, and we don't really know how it's going to impact our population, where we have a significant portion that is vaccinated or has some level of immunity from prior illness with COVID, and so we'll just see how that impacts our numbers. And watch the data.
Now, if and correct me if I'm wrong, if this new variant is milder than Omicron, that tells us that maybe the virus is phasing itself out?
Well, it's hard to predict. And I think that's the thing with COVID-19. I think none of us are in the prediction game for this virus because it has, brought us so many ups and downs and curveballs over the time. And so, viruses are going to mutate, and we're going to see variants, right?
Absolutely.
However, we hope that the impact of those variants decrease over time, and we get there by vaccination, right? We get there by immunity and increasing immunity in our community.
Yeah, absolutely. Well, my last question is, some people say, well, I've had COVID, I'm immune, I don't need to be vaccinated. Well,
right.
What do you think of that?
Yeah, so we know that they do have some level of immunity, right? But we don't know how long that lasts, and we don't know, the level of immune response varies considerably by people who are infected by COVID-19. The level of immunity from vaccination is more protective than illness, and so the people who have had illness still need to get vaccinated to ensure a proper immune response.
Absolutely. Is there anything I haven't asked you that people need to know?
Yeah, so you mentioned this earlier about masking and other measures and staying vigilant. And,
yes.
What the message that I would like to share is that, we're at this point where we need to really lift up what's most important and kind of frame these measures that we need to do as kind of everyday health measures and good practices, right? As we kind of learn to live with COVID-19. So getting vaccinated and boosted, we talked a lot about that. We're, in Wayne County, we're at 67% who've been fully vaccinated, which is higher than the state rate. So I'm very proud of that, but we still have a lot of progress to make there. The other thing is staying home and away from others, right, when you're sick. This is just good practice in general, right? If you're not well, you stay home, you kind of try to keep to yourself, you go get tested, and follow healthcare provider recommendations. Getting tested, you mentioned as well, is very important for people. The government has provided 4 more tests for people to be mailed to their home. So I urge people to go on that covidtests.gov to get their home tests, get another round. You always want to have them around just in case. And you mentioned masking earlier. So the masking, it's not required, right, in most settings right now in Michigan. But it's still a really important tool that I want people to have access to and to reach for depending on the situation, right? So it could be that, you are going to some crowded indoor place with really bad ventilation. At this point, that's the time when you want to consider wearing a mask, depending on your own risk factors, right? The other, if you test positive or you have close contact with somebody with COVID-19, those are other scenarios where you still want a mask. And so there's still something you want to have around, high-quality masks that are much more accessible and that we should still be reaching for in certain situations.
Absolutely. I want to thank you so much for taking the time to be with us and share this valuable information. Thank you so much.
Thank you.
Absolutely. We're going to take a short break. Please stay tuned.
When you're looking for the best in optical care, Dr. Imad Nakash is your doctor to see. With years of experience and thousands of successful procedures performed, you can trust your eyes to Dr. Imad Nakash. See Dr. Imad Nakash and his professional staff for your eye care needs. There's 2 locations to serve you. In Hazel Park, call 248-336-3937. 248-336-3937. In Rochester Hills, call 248-299-3937. That's 248-299-3937.
بعد تطعيم أكثر من 3 بلايين شخص حول العالم بشكل كامل بلقاح كوفيد-19 تمت الآن الموافقة على تلقيح الأطفال من عمر 5 إلى 11 سنة. فقد أثبتت الدراسات بعد تجارب سريرية مع أطفال حول العالم أن جرعتي اللقاح المخصصة لهم آمنة وفعالة. يوصي الأطباء بتلقيح الأطفال من سن 5 فما فوق من أجل حماية الأصحاء منهم أو ذوي الظروف الصحية الصعبة. الطفل جزء من المجتمع وهو معرض لأن يصاب بالفيروس ويمكن أن يحمله لعائلته ولمن حوله. احمي طفلك وعائلتك ومجتمعك. لقح طفلك ليكون بأمان في المدرسة أو مع العائلة والأصدقاء وأثناء ممارسة الرياضة. تحدث لطبيبك واكتشف الحقائق بنفسك أو زر موقع michigan.gov/kidscovidvaccine. رسالة من وزارة الصحة والخدمات الإنسانية في ميشيغان.
Kashat's Mediterranean Market in Shish Kebab offers a great array of your favorite Mediterranean meals. Meals range from lamb specialties, shawarma sandwiches, and seafood dinners. Plus, they offer big trays of your favorite food and so much more. Kashat's Mediterranean Market in Shish Kebab is located at 32839 Northwestern Highway in Farmington Hills and is open from 9 a.m. to 9 p.m. So stop in or call Kashat's today at 248-538-9552. That number again, 248-538-9552. Kashat's Mediterranean Market in Shish Kebab will definitely leave you satisfied.
Welcome back, and thank you for being with us. And I would like to thank our guests today, Stacy Blusner and Dr. Sheth from the Wayne County Health Department for sharing valuable information about the business loan and about the coronavirus update. I think Jerry is with us, Mike. Is that correct?
Yep, he's on.
Good morning, Jerry.
Good morning, Mr. Khalil Hachem, and thank you for taking my call. Mr. Khalil Hachem, in Arabic, there is a famous phrase that say, التاريخ يعيد نفسه مرة أخرى. Mr. Khalil Hachem, 1991.
History repeats itself.
Yes, the history repeats itself. Thank you, Khalil. Khalil, 1991, the first, when former Iraqi President Saddam Hussein invaded his small country of Emirate of Kuwait, and I know that was wrong and very wrong. But did you see, Mr. Khalil Hachem, 33 countries, 500,000 armed forces, they were attacking Iraq when Saddam Hussein refused to leave Kuwait, and the bombardment was day and night. Iraq was destroyed almost completely. البنية التحتية حطمت. يعني Mr. Khalil, we look today to see Russian President Vladimir Putin attacking the country of Ukraine for no reason. Just the crime is this country want to join the NATO. Okay, there is a diplomat channels to do that, but does not give you, Mr. Putin, the right to come with over almost 170,000 soldiers, Russian, and you've been attacking this country from the sea, from the air, even hospitals and daycare and senior citizen and theater. Yesterday, people, they were standing to collect bread, and they were attacked. 10 people, they were killed, among them one American citizen.
You know what that reminds me of? You know what that reminds me of? When Israel invaded Lebanon in 1982. When Israel invaded Lebanon in 1982, Israel did the same thing. And then when the United States attacked Iraq in 2001, 2002, the United States did the same thing. Do you know how many Iraqi children died in at that time? 600,000 children alone.
I know.
I mean, this is you know what it is. It's just the powerful don't care, and they should be held accountable. And people who have power think they can do these kind of things to other countries, and it's unfortunate because, as I said at the beginning, life will never be the same in Ukraine. And I think, the Ukrainian president also takes some blame here because he could have avoided this madness. And then I'm not saying that the Russians are right. They're not at all. There's no reason for all this brutality and for invasion. But, Jerry, that it's unfortunate that we don't learn from history.
Mr. Khalil, excuse me, what do you think about enforcing the no-fly zone and the MiG
once you enforce a no-fly zone, that means we're going into World War III. Enforcing a no-fly zone is really not the answer to this. The answer to this is we find a diplomatic answer. I don't think the U.S. and other countries have done a good job from the beginning at trying to resolve the issue diplomatically. We did not. and this unfortunate. You know, we were talking about war before talked about peace, and that's very unfortunate. The best thing to do is
Mr.
to
Khalil,
stop the
excuse
war.
me, what about MiG-29, the one Poland want to give it to Ukraine? What do you think about MiG-29? Should we give it to them or not?
We can give it to them. We can give them all the weapons. You know, the more weapons you give, the more oil is going to pour on the fire. We need to stop the fighting, not give them more weapons. You know, stop the fighting, stop the killing. That's what we need to do. You know, giving them more weapons, they're going to kill each other more. You know, just stop the fighting. And I understand that people want to give Ukrainians weapons to protect themselves.
Has the right to defend themselves. That's what I try to say. Defend
themselves. They do. But at the end of the day, you're dealing with a superpower, and unfortunately, we don't want to get into World War III. So it's a delicate situation. Stop the war. Stop the killing. This is what we need to be focused on. You know, Ukraine is an independent country. We need to preserve that. We need to preserve it diplomatically, not militarily. Anyway, Jerry, thank you so much for calling.
Mr. Khalil, thank you for taking my call, and peace on earth. Thank you.
I hope so. No reason to kill anybody. No reason for anybody to die. Thank you so much, Jerry. One last thing before I leave you. Absolutely. Thanks, Jerry. One thing, you know, before I leave you, I want to repeat one thing that I always repeat at the end of the program, which is the housing market. You know, recently the Feds increased the interest rate, but don't be affected by that. This is still a great time to sell. If you have a property for sale, let me know. We will help you get it on the market, get you the most money for it. This is the best time to sell. 313-819-0101. 313-819-0101. If you have any property to sell, this is the best time to get the most money for it. Again, 313-819-0101. The market is very hot. We're selling homes in 1 day. We could sell them in 1 hour. Okay, so whether it is residential or commercial, we will help you with it. 313-819-0101. Thank you all. Have a safe weekend. Thank you, Mike, for a great production. And thanks to all the guests. Thanks to Jerry for calling. Bye now.